Today, more than half the world's people live in cities, and by 2050, that figure will grow to be 2/3. That puts cities at the forefront of our efforts to enable more women and girls to lead healthy, prosperous lives, including having the ability to decide whether, when, and how many children to have. In my travels, I've met with a lot of women living in poor urban areas and talked with them about their struggles to create a better world for themselves and their families. And time and again, it's women who raise the issue of access to contraceptives and health education for both themselves and for their children. So many have repeated unintended pregnancies, often before they're ready to have children. And because they know the devastating effect that poor health has on their families and their communities.
Family planning is one of the best investments one can make in achieving the Sustainable Development Goals. According to the Copenhagen Consensus Center, an independent research body, for every $1 that one invests in family planning, you reap the benefits equivalent to $120.
I'm really pleased that we got family planning in at the beginning of the SDGs. It didn't come in at the beginning of the Millennium Development Goals, and that made it that much harder to make family planning a priority. Family planning makes contributions in so many ways. In addition to allowing people to make choices about the number, timing, and spacing of their children, family planning lets girls stay in school. It lets women spend time outside the home to engage in the economic and political development of their countries. It opens up this space for women and girls to participate that then opens up all kinds of other spaces. I think once you realize you can control your fertility and you know how to do it, almost everything else becomes an option.
We used to really spend all our energy trying to get family planning to women in rural areas. But two things have changed. Now over half of the world is urbanized. And more women and girls are moving to urban areas because that's where they see opportunities for themselves. Half of China's migrants are women. In many other countries, we are seeing a trend. Bangladesh, young women are migrating to urban areas to take jobs in the garment sector, in factories. For them to be able to face the urban environment and to be able to have jobs, to be able to prosper, to be able to travel and do the things that you need to do, having family planning and the security of family planning is absolutely essential.
Avec l'urbanisation extrême qui est en train de venir dans les pays africains, on se dit qu'on va avoir les problèmes des pays développés beaucoup plus tôt qu'on ne pense. La planification familiale, c'est une condition nécessaire pour le dividende démographique, définie comme l'accélération de la croissance économique qui pourrait survenir du fait du changement de la structure de la population. Lorsque la fécondité baisse, on peut utiliser les ressources pour que le marché du travail soit plus dynamique. Dans les milieux urbains, pour un enfant entre 0 et 5 ans, les femmes mettent environ 5 à 6 heures de temps par jour pour un seul enfant. On a estimé le temps domestique qui n'est pas pris en compte par la comptabilité nationale en 2011 au Sénégal à 30% du PIB.
Human population influences and is influenced by the environment. And in many countries, chronic poverty, repeated economic and environmental shocks, and poor health contribute to recurring cycles of crisis. Between 2000 and 2010, more than 2 billion people worldwide were affected by disasters, requiring national and international humanitarian assistance, and hundreds of thousands of lives were lost. To increase resilience, women, households, and communities need the ability to quickly and effectively respond to new circumstances. Family planning may be a transformative approach in changing people's ability at multiple levels to adapt to environmental change and break these cycles of crisis.
To help cities become catalysts for human development, our foundation is working with governments, donors, civil societies in Africa and Asia to expand access to urban health programs that offer proven solutions. Over the last several years, experts in 4 countries, India, Nigeria, Kenya, and Senegal, tested and evaluated a variety of high-impact solutions that were designed for urban settings. Things like working with private distributors to eliminate stockouts, myth-busting discussions, radio and public information campaigns. In all 4 countries, there was an increase in modern contraceptive usage of 10 to 18 percentage points among the poorest women. This is progress we want to build on, Through a new Challenge Initiative program, the Bill and Melinda Gates Foundation will offer an incentive for donors, governments, and civil society to expand these proven interventions over the next few years.
TCI is business unusual because it brings together key innovations in the development financing business. It operates on the principle of self-selection, meaning the cities self-select in order to become part of TCI, and they will have to bring their own resources to the table. If they're part of TCI, they will have access to a challenge fund, initially seeded by the Gates Foundation, so that for every investment that you make, you leverage other resources. It practices angel investing, a very entrepreneurial approach in which the partners receive a core investment, and then they can grow that investment over time as they bring in more cities and geographies as part of TCI. And finally, efficiency and effectiveness is built into the performance metrics, which means that donors, including high net worth individuals, would be able to see the return to their investments.
Investing in family planning saves lives and unlocks the potential of women everywhere. It's one of the best investments that communities and countries can make in their futures. Working together, we can create a future filled with promise for millions of women and children.